these air fluid levels are non-specific. You can see that with gastro, you can see that with an obstruction. So again, trying to interpret the pattern, kind of replace these with more specific investigations, ultrasound, CT. They'll tell us a lot more about free fluid and free air. If you were to see like a dark line sitting here under the liver, that's free air, then you say, aha, badness, we got a perforation here. But what we can say here is that there might be something going on, and again, it'll depend on the history. Small bowel dilation, these loops are big. Again, you have to know what normal is, but there's all these sausage-shaped loops here. Someone who's got a big belly and vomiting could be a gastro, but there could be an obstruction too. Large bowel, it's the colon there. You often see these kinds of patterns, like let's say a Hirschsprung's, where there's an obstruction distally, megacolon with maybe inflammatory colitis or Crohn's or something. You can see those patterns. Major GI bleed would be another abdominal emergency. Pretty uncommon again. We see a few kids that have, usually they'll have a history, so they'll have known liver disease or portal hypertension or some reason to have a bleed, maybe peptic ulcer disease occasionally. If you got bleeding, you can go through various algorithms. From the transport point of view, it's basic ABCs. Right? If you are unstable enough, they may need control of their airway, they need volume resuscitation, bowel decompression would be important before getting into an airplane, the large bore IVs, just really treatment of hypovolemic shock. And I guess if you know that they're bleeding, you might take blood with you, but don't know, I'm trying to remember the last time we had transport for something like this. I guess it could happen. You might go to Santa Kilowak and have a patient.
Lots of bleeds are probably ones that we see the most.
Which are?
TNA, post-TNA bleeds. But that's something
yeah,
that
it's
they're
not really
usually
GI,
seen.
that's kind of
Yeah.
upper, but they might present as a GI bleed if you didn't know. Like bad nosebleeds sometimes present as a GI bleed because they were drip, 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 drip down their throat, and then they throw up all this blood. So that could be a misnomer if you don't realize that they've had a nosebleed. The post-TNA is about a week post. Most of them stay in the city,
Yeah.
so that at home that
Dental surgery.
doesn't end up happening. Yeah, yeah. But yeah, major upper GI bleed could be quite terrifying. But from our point of view, it's you know, like treating any major hypovolemic insult, volume resuscitation, trying to correct any coagulation things if we can. Probably can't at that point. What we might want to do is start on like an IV PPI, pantoprazole, something to block acid. It might depend where you're going, whether they have it there. More specific kinds of treatment like that. So no, if we go to a nursing station, I'm sure not. But well, I shouldn't say sure not, because we had it in Sani and used it. Yeah, yeah. So they're aware, you can have major GI bleed.
Yeah, there's nothing you can do for that.
There's nothing you can do for that. Portal hypertension, there are special tubes you can put in to try and tamponade the bleeding from esophageal varices. But bleeding, like major gastric bleeding, it's just trying to volume support them till they can get somewhere where they can treat it with
So we would try-
gastroscopy.
In
and
that situation, we would try and move that,
Try and,
bring that shot, like the situation that we saw here, you would try and bring that to Winnipeg.
you wouldn't have any option, would you?
I mean, would be just like,
Well, the,
Cause if you don't know what the cause of the bleed
I
is.
know.
That is
see,
here for
you
surgery.
got bleeding, you don't know the cause
Yeah.
of blood.
Yeah.
Hopefully, you've got blood to support them, hopefully you can get some large IVs in. And
But you can
it's
pump the
kind of
blood
a
in as
full,
fast as it goes up,
full ongoing, resus with,
Mhm.
pumping blood. Here, it's more the technical thing, so you got a 12-year-old like this, you can't be running fluid on a pump. You gotta use pressure bags, you gotta use large bore IVs. So they're more, I think it's more the technical issues, than anything. And it'd be the same as if you go for major trauma somewhere. You know, what can you do in a very isolated, low-resourced place, other than bring what you can with you? Perhaps a physician in those circumstances, if you had a major bleed going on. Prompt resuscitation, yeah, acid suppression if it's bleeding, and again, yeah, X-ray, really doesn't have much to offer. So we wanna try and sort out of all the conditions, the major bleeds are usually obvious. It's which are the surgical disasters waiting to happen, so a high index of suspicion for volvulus intussusception. They may not have peritonitis, or they may not have rebound and guarding, but I think anyone who's got an unexplained acidosis and ongoing fluid requirements, it's just a high index. Why, what's going on? You know, what is going on here?
I went on a trip with Kathy one time, and it was for a baby in Boundary Trails. And then we did done telehealth, and the baby, it was a little bit tough to tell, but you know, it wasn't really working or anything like that. But anyways, we get there, we see this baby, had like total scaphoid abdomen, ended up being a duodenal atresia, but the baby was breathing probably at a rate under 20. And when we did a gas, was like, because you talked about metabolic acidosis, it was like super alkalotic, because just that history of constant vomiting. So I guess
That's your classic pyloric,
right.
right? So the acidosis comes from bowel ischemia. The pyloric stenosis, or this one, is that other special case where they're extremely alkalotic because they've been vomiting all the acid out of their body, as opposed to these other ones where the gut is dying and it's ischemic, so you have the acidosis. Yeah, that'd be the classic pyloric duodenal there. And, yeah, and they hypoventilate because they're so alkalotic.
Yeah, they're
and,
compensating
Trying to
the other
compensate.
way, yeah.
they don't have any potassium left, and,
And also too, I was gonna say, so if you see a abdomen with like a lot of distended, gaseous kind of thing, so transport consideration too, like would you probably want to go fly with like a lower cabin type thing?
yes, you would. You can't decompress the bowel, but
'Cause that
you
could
wanna keep
exacerbate
it
it, right, if
pressurized,
you're-
yeah, particularly if you've got an obstruction or a severe ileus, yeah. I don't know if anyone's perforated from
Yeah.
just the altitude change, but you would certainly.
So you'd have
It's
to
a
fly,
good
you
point.
have to fly ground level.
don't
so-
want to be
Yeah.
first to find out.
Yeah. Good, okay, that's all I have.